recording. Let everybody in.
Good afternoon, everyone. How are you? Good. I don't have a very many updates, but I'll run through those really quickly, turn it over to Director Bond for an update on nursing homes. And then Dr. Dalal and Director Bond want to give a somewhat high-level strategy brief presentation to give you an idea of what we're thinking of the coming, where we're at of the coming days. So we're at 859 confirmed cases right now and 23 fatalities. That's a jump from yesterday. Fire department has 14 positives. Police department is still at 6 positives. Fire department has 29 individuals out, and the police department has 19 officers out. And the fire department has 21 people at UNH. Police department has 3 people at UNH. We've been asked to direct all questions about the CVS facility to the state, but I would, I do want to underscore something that I think is important for us to start thinking about in the next week or two, is that because we will have a significantly increased number of people being tested, it's likely that we will see the number of cases that we're identifying rise quite quickly. That isn't a necessary indicator that the virus is spreading more or less. It's actually hard for us to know exactly, given those additional, that additional data, what the virus is actually doing. But I wanted to warn the press that you're likely to see increased numbers of positive cases simply because of the fact that we'll be testing more people and identifying more people that already have the virus. Why don't I hand it over to Director Bond, who can give an update on nursing homes. You're on mute.
Good afternoon. So today for nursing homes, we have, for the Grimes, we had a slight change from what I reported yesterday. We went from 55 to 54. For Mary Wade, we have some residential, we have about 26 and also 7 staff. We have a combination at Regal Care of 17. We also have a combination at Bella Vista of 13. And those are my reports of today. After today's briefing regarding nursing homes, I will transition into once a week to provide updates regarding those numbers because they slightly change from day to day.
And just to be clear, Director Bond, when you say a combination, you mean a combination of staff members and residents, that we do not have full data on of that combination, who is staff and who is residents, correct?
Correct.
Okay. So why don't I hand it over to Dr. Dalal, and then we can open it up to questions afterwards.
Right. I want to share with you a presentation. I think there's been a lot of talk in the national media as well as state media about reopening the economy and the timing for that. There are a number of groups that have come together regarding how that should be done and some detailed plans laid out. I just want to share with you some of our thinking in terms of forecasting the epidemic and potential implications for opening up for business. This really is about looking ahead, 2 or 3 weeks and what our response will look like and how we're thinking about it in New Haven in terms of the next phase of the epidemic. Hope you can see the next slide there. This slide was put together by leading experts in public health, led by the former director of the CDC under President Obama and his group. And I think it provides a very good picture as to what we should be thinking about with respect to the epidemic. This outlays 2 general scenarios. The top scenario is a scenario that happened in Italy and New York City, where we had a very high peak of cases. Potentially, we're starting to come off that peak in New York City. Potentially, we're getting close to that peak in Connecticut. We don't know yet. Day to day, that changes, but many experts think we're close to the peak and starting to see a leveling off. But it's interesting when you contrast that with the scenario listed on below, the Singapore and the China outside of Hubei province, where the peak was much lower. The key difference there is that in the initial part of the strategy, there was a very aggressive, proactive response in Singapore and other parts of China outside Hubei province that prevented the peak from spiking very high. Unfortunately, in the US, we missed that boat. It's well known as some of the issues around testing that got in the way of us being very aggressive around the initial peak. But now what we're thinking about, how do we, now that we're plateauing and probably coming down in some cases, how do we put together an aggressive framework that helps us suppress the disease from recurring and resurgence? This is a substantial area among public health officials, is that if we do the loosening up of the restrictions and the opening up the economy the wrong way, you'll end up with a resurgence and back where we started with respect to our response. So what this framework, I think the most important part of this framework is to understand that there may be other peaks of COVID-19 coming. Many people think there'll be a secondary peak in the fall, maybe something before that. We may be in a scenario where we have to get used to this idea that we loosen restrictions when the epidemic is at bay, but then we tighten them back up with respect to our social distancing policies when we sense the epidemic is back in an upswing. This might be what they talk about as a new normal with respect to how we're going to be operating our businesses and our society in general. The important part to remember here is just because we might be close to being over the hill does not mean that we're out of the woods. We do need a very data-driven approach to deciding on how we loosen up our social distancing restrictions. So Director Bond and her team can perhaps, I know has been on top of the data, but we'll be looking at data very closely to help us inform how we do our kind of reopening strategy, along with our partners at the state. I know who are also have announced some high-level committees that are going to be looking to how we do this in a smart way and without setting us back into a resurgence of cases. I would sort of offer the analogy that the loosening up of restrictions is more like a steady hand on a faucet, where we loosen up the restrictions and let the water flow slowly initially, and then assess how things are going, and then loosen it up a little bit more if the disease is not making a resurgence. So the question is, how do we make sure that we are suppressing the disease as we potentially move past the plateau? I'll offer here this next slide, providing the 4 pillars of a public health core approach to making sure we keep coronavirus at bay moving forward. The very first important strategy, and we've heard the mayor and Director Bond talk about this often, is that we really need to ramp up our testing. Testing needs to be done very widely. It's part of the reason that the US didn't have a jump on the response, that the testing wasn't available. So that's pretty well known. But there's 4 pillars to that. You can't just end with testing. Once you test, you need to have a very robust system to isolate people who are infected. So we want to have a positive approach to isolation. So voluntary isolation, helping and supporting people isolate in their own homes, so they don't feel that they have to go out and meet basic needs. So that's our approach at the city level. Beyond just isolation, we need to have a very robust system to find anybody that person who has a positive result came into contact with. And those people who are found to have a close exposure to the infected person should be asked to quarantine for 14 days. Again, our approach is to have a positive approach to support anyone who needs to quarantine, that they have the ability to do so. This is the core strategy of how we're going to be able to box in COVID-19 moving forward. Again, this is made in reference to a major public health organizations that have developed consensus among a number of experts that have put forth this approach. So I'll turn it over to Director Bond for a little bit more, if she might offer a little more detail on our contact tracing plan that we put in place.
Absolutely. So, as indicated in previous press conferences, our efforts are to identify positive cases, ensure that they're isolating or being quarantined, and then also contact tracing. So, what we've done is really ramp up our contact tracing efforts. To date, we have 70 contact tracers that are actively making phone calls and tracking and engaging those positive cases to conduct interviews. We have additionally trained 90 additional volunteers that are now ready to go so that we can provide additional support as the testing's capacity increases. And so we're really excited about the progress within our contact tracing efforts so that we can ensure that we are working diligently to contain and also mitigate the spread of COVID-19.
So just to give you a little bit more sort of high-level information about this, there was an article in the New York Times today about what Massachusetts is doing, and they have about a goal of 1,000 contact tracers statewide that will help with this effort. And just, to give an example, if I were to contract COVID-19 and there weren't as many cases now, and we wanted to make sure that as we try to open up society, we clamp down on any potential outbreak, I would get tested very quickly and get the results very quickly. If I were positive, then the contact tracer, whoever that may be, whether that's someone under our health department or run by a statewide initiative, would call me, get my information about where I've been in the last 14 days and who I might have had interactions with, do an assessment of those individuals and whether or not they had enough interaction and the type of interaction with me as to whether they might be at risk of having contracted COVID-19 as well. And if that assessment indicates that they are at high risk, then they also would be asked to self-isolate. And so very quickly, if the system is, the testing system is, and turnaround is done quickly, if the contact tracer reaches out to individuals that may be exposed quickly, and those individuals self-isolate quickly, then the scope of the outbreak is much more, is likely to be much smaller. And so by our preparing for that kind of response, it will allow us down the road to open up with less potential for a large outbreak. We're excited to see what Massachusetts is doing. We're working to do our part in New Haven on this and are hopeful that the rest of the nation and other entities in the state also do similar efforts to make sure that what we can accomplish what we all want to accomplish, which is eventually open up, but we've got to do that in a smart way that keeps people safe. So why don't I open it up to questions from folks? Go ahead, Shayna.
I can't see if any of the chiefs from the fire department or the police department are on this call, but I guess I could start with you, Mayor Elicker. You gave an update on the numbers of first responders that have been impacted by COVID-19. And of course, with that, I'm imagining there have been some adjustments to how first responders do their job in the city. Can you, if you can speak to that, can you kind of tell me what changes, if any, have happened as far as how officers do their job given the circumstances?
I can give you some information. Neither chief is on the call today, but I can give you some information. And to be honest, we're quite pleased that in general, the numbers of firefighters and police officers that have contracted COVID-19 is relatively low. If you'll notice, that number in the last week or so has not risen significantly. Yesterday, firefighters had 13 positives. Today, they have 14. Police have plateaued at 6 for quite some time. There's a number of things that both chiefs have done to reduce the likelihood of exposure. For example, typically police will respond to medical calls in addition to our fire department responding to medical calls. But generally, unless there is a specific reason, police no longer respond to medical calls. unless they're asked after the fire department arrives for assistance, or unless the call that comes in may indicate that a police officer will be important to have there. And so that reduces police officers' likely exposure to COVID-19. Police officers are not traveling together in the same vehicle anymore. And so if one gets it, they're not likely to expose another or risk having another, even if they're negative, out until they have to get their test done. The fire department has issued additional protocols where, because our health department has information on addresses of people that have tested positive, and share that information with the fire department before the fire department may respond to a call, they know if there's a potential risk to the fire department of COVID-19. And so they won't go into the building without making sure that they contact, unless there's obviously a fire or something major, but usually we respond to medical calls until they contact the individual inside and get more information on what's going on. And those are just a few examples of ways that we're trying to reduce the exposure. And frankly, we've been quite happy that the numbers initially were going up pretty significantly, but in the last week or two, they've been much more leveled out.
All right. Thank you, Mayor.
You're welcome. I saw Tom with his hand up.
Yes, thank you, everyone. And thank you for that presentation, Dr. Dalal and Director Bond. I want to start with that presentation. Dr. Dalal, the 4 pillars of the city's strategy for the next couple of weeks, from testing to isolation to quarantining, all strike me as requiring a pretty significant just government capacity. I know right now the city and the state are helping put up a lot of homeless people in hotels, and there's a lot of scrambling trying to figure out how to make as many tests available as possible. And then it sounds like Director Bond has a small army of volunteers. I can't imagine that the city wants to rely on volunteers, however well-meaning, for so long. Do you all feel like the city has adequate capacity to execute the kind of plan that you're outlining? And if not, how do you make this happen?
Yeah, I can start with that. I think, you know, for the short term, we do have the current capacity to carry out the plan. Again, thankfully, we have anticipated that with more testing coming online to increase our contact tracer capacity. I think even in the past week, we've gone from a capacity of 50 volunteers to, I think Director Bond mentioned, almost
120.
Oh, okay, great. So we're on top of that.
Oh, sorry, 160.
Okay. We do agree that we do need substantial capacity in the government level to make this happen. So that's why we're collaborating with our partners in the state regarding specific populations. You mentioned the homeless population. So again, we're not doing this alone. We're doing it in collaboration with the state and understanding what resources they may have to bear to help with this effort. But we also want to, you know, be very aggressive where we can be from a municipal level, and hopefully, you know, the state sometimes, you know, follows what we're doing here. So we're hoping that's the case here as well.
Yeah, I just want to add to that. We also have 15 public health nurses doing contact tracing. So those are full-time staff that are also in conjunction to the 160 volunteers that I just mentioned. And so we do have some internal infrastructure in place. And in addition to Dr. Dalal mentioning, the Department of Public Health are currently assessing the ability to launch a statewide contact tracing effort. And so they're having preliminary conversations around that, and we provided information as a city on some of the efforts that we've been doing as they were collecting and doing assessments around the state.
I think I know that you asked Dr. Dalal and Director Bond, Tom, but just to add to that, so first of all, clarifying point, the volunteers are not working full time. And so, you know, some of them are doing a lot of hours, others are not, which is why it's important to have a lot of volunteers. There's so many people that have reached out trying to find ways to help. And the requirements for a contact tracer is some medical background, so that they can ask the right questions and use some analytical skills. But it's not an incredible amount of medical background. So this is a really good way for us to provide volunteer opportunities to people that can actually do this from their own home because they're just using their phone. And so we anticipate that we'll continue to have people volunteering because there's so many people that want to help out, and a lot of people that may not be able to help out physically because they may be a higher risk group, for example, or they may not have a great schedule, but they can help out from time to time. I would say that I don't think any of us around the nation feel fully prepared or feel like we have all the resources to implement any of the plans that ideally we would implement. I do think that we're doing the best that we can, and that we've, with our team, set out a pretty solid framework for addressing the problem. Ultimately, with contact tracing and with testing, we can't do it as a city alone. It's got to be done on a regional basis, and we're doing our part to help out. But you just imagined someone from Cheshire that happens to live in New Haven that takes a trip to Bridgeport and goes to a party and interacts with a lot of people in Bridgeport, and then gets symptoms and tests for positive for COVID-19. That can't just be New Haven calling all these people around the state to identify and help them self-isolate. There needs to be a regional approach to the problem to address it in the long run.
And Mayor, I imagine over the next couple of weeks, we'll start hearing about the budget impact of COVID-19 on the city's budget in particular. Is there anything that you can speak to now as to, I know in previous presentations you've spoken about parking meter revenue, building permit revenue, a whole bunch of other stuff declining. Do you have a sense of how the city is being hit financially by this? And again, how that might impact the city's response going forward?
I think it will be significant, and there has not yet been a lot of discussion from the national partners about the revenue side of things. And so what I mean by that is there has been a lot of support for the expense side of things. We've had some grants from CDBG and HUD to support, for example, some of the initiatives that we're doing on the homeless side. But one of the major costs to the city will be the decrease in revenue. And for this year's budget, that will be in the areas of our reduction in tax collection, in building permits, and meter revenue, and parking tag revenue, as you mentioned. That's going to be significant. I don't have specific numbers from you, but it'll be difficult for us to make those numbers up. And there has not yet been the discussion at the federal level to help make up for the revenue losses. It's mostly to cover the additional expenses that we're incurring. And so that's something we're concerned about. And you all will see that the Board of Alders is going to vote on what the governor has required municipalities to choose as far as facilitating a real estate tax deferral or decreased interest rate, so that people that are experiencing hardship related to COVID-19 can pay their real estate taxes later. And while there are two options that the governor has provided to municipalities, and I know that the Board of Alders is still deliberating and exploring the impact of both of those options, we're aware that the impact of that will certainly create some cash flow issues with us, because if we experience a significant delay in the real estate payments for the coming fiscal year, then we may have issues where we're not able to pay some bills on time. We have a plan to potentially address that. And the nice thing is that every municipality in the state is in the same boat. And so that we can all work together to potentially address a timing issue with when we will receive our real estate taxes and when some of our bills come due. One more thing, this is a long-winded answer to your question, but what we really don't know is the long-term impact on our fiscal situation. And that is related to the overall economy. We don't know if residents that are homeowners that have lost their jobs are going to be able to pay their taxes, for example. And so I think that we can expect some reduction overall in revenue next year. It's hard for us to tell at this point how significant that reduction will be.
Thanks very much. I've got a few more, but I'm happy to defer for a bit to others.
Sure. I saw Mary had a question.
Hi. I guess maybe following up on that, you said that Board of Alders is considering these options. So have they been meeting in committee, or how are they considering it? Are you just talking
I
about leadership?
defer that question to them. The governor's presented two options in one of his orders, and so you can
Right.
read about those. But I presume you already know about them. And ultimately, that's up to the legislative body to determine what option they go with.
All right. Sometimes you're breaking up here, but in terms of them discussing it, I mean, usually these things will be discussed in public. I mean, I don't know if it's just the leadership you're talking to at this point.
Yeah, I can't remember the due date. I think it's maybe April 25th. And so the timeline is tricky, and they will presumably do this in a meeting in the near future.
Okay, and I just like the whole contact tracing. Ultimately, how many volunteers do you think you need? And what's been the response when people have been called and said, you know, you've been in close contact with this person who has it? Have they been responsive? Have they agreed to isolate? And I don't know how far you keep tracking them.
Yeah, so we continue to track them within the period, within the 14-day period, and we also conduct the contact notification process. So right now, we do have, if you notice some of the things that we discussed in prior press conferences, is that we do have a significant amount of individuals that do not have complete data. So there is a percentage of individuals who are not able to contact. And so we issued an official memo to those facilities that to ensure that they're completing the proper fields, because that does interfere with the contact tracing process of newly diagnosed individuals. Overall, it's been a positive response, and we are tracking it, and we can provide a detailed report once we have a full month contact tracing that we have in our database.
All right, what does the training consist of? I mean, you want somebody with some kind of medical knowledge so they will know the terms that they're looking for, I guess. But,
yeah, we developed an entire contact tracing process where we are asking and interviewing individuals. We provide recommendations based on the CDC guidelines. And so we developed an entire web platform where we have a script, we have an entire contact tracing interview process similar to the SARS in contact tracing form that we modified and developed to consist and correlate with COVID-19.
Okay, and you did that in-house?
Absolutely, with our internal team.
Okay. I know some people from the public health school at Yale were doing this. Is it more than them?
We have volunteers from the Yale School of Medicine, nursing program, and public health program.
Okay, but beyond that, you have other individuals who just come up?
Beyond that, we have 15 public health nurses that are employed with the city.
And we're going to also put out a call, the volunteer call, to get more people to sign up.
Exactly. So we are in a recruitment mode now.
Okay. And again, it's just not just anybody. I mean, it's somebody you need some kind of medical knowledge. Is that what you're looking for?
That is our desirable qualification, minimum qualification.
All right. And again, people are being responsive. I mean, they don't say, I don't want to talk about this. You know, this is not none of your business. I mean, people are actually.
Yeah, overall, people are really grateful to get a call. So it's been working really well for those that we do reach, and you know, again, we'll provide a detailed report once we gathered enough data that we can be able to formulate it into a report format.
Okay. I have some more questions, but if someone else wants to ask.
Let's go with Michael Bingham.
Good afternoon, Mr. Mayor. Thank you. If the city has some latitude to chart its own course with regard to, you know, how it might begin to lift restrictions in a safe way, or ease restrictions, you know, based on the framework that Dr. Delisle just outlined, do you feel the city also has any latitude with regard to the when, or is the city, you know, committed to moving 100% in lockstep with state government, and May 20th is it for non-essential businesses?
So I'm not even sure if the state is locked into that May 20th date. So I wouldn't be under that impression. I think we're all seeing how things go. I think it's very important for us to collaborate at the state level and at the regional level with any conversation about opening up. And even though we've talked about the the process of opening up some on this call. I don't want anyone to have the impression that we are thinking that this is imminent. As Dr. Dalal said, we still don't know if we are at the peak yet or if our cases will continue to rise at a faster rate. And so it's important for us to stay the course, stay home, continue to do the social distancing, and that's what we'll continue to encourage the public to do. And I'll reiterate, I think it's very important that we do this regionally and collaborate with all of our state and other state partners to make sure that we're doing it in the right way.
Is this a model, a framework that might be shared and used by other communities, or that you've discussed with other communities about some uniformity in doing it this way?
I've raised on it. So I have a weekly call with other mayors of large cities, and we've had some initial discussions about this. You know, it's not like New Haven is making up something new here. Like I said, Massachusetts is looking into this. There's been some conversations in other states as well about this. Epidemiologists are suggesting that this is one of the things that is very important to getting on top of future outbreaks. So we're just trying to get a head start on it so that we can make sure that we're prepared and practicing what we're supposed to be doing to prepare for down the road.
Thank you.
You're welcome. So before I go back to Tom and Mary, does anyone else have any questions? Okay, I'll go to Tom.
Thank you. Dr. Dalal, you said that the city will be, in keeping with that faucet metaphor, of turning on the water a little bit, assessing how it's going, and then either opening or easing or making stricter the social distancing restrictions. Could you speak to what the city will look to when it's conducting that kind of assessment as to how easing social distancing requirements are going, whether looking to the number of new infections or hospitalizations? You speak to some of the information that you'll be keeping your eye on.
Yeah, I mean, I think a part of the principle of this is that we have to have our eyes on the virus and know exactly what it's doing. Again, our information is not necessarily as ideal as everyone would like it to be and as timely as we'd like it to be. I think our main source of information will continue to be the State Department of Public Health with respect to their verified cases, but we also obviously have our data feeds from our local partners as well. So I think we'll be looking at number of cases. We'll be continuing to monitor hospitalizations. Just because, as what the mayor mentioned, the number of cases will vary with the amount of testing that's going on. I think it's potentially a more accurate way to assess the epidemic, to looking at how many people are getting hospitalized with COVID-19. So we'll keep a very close eye on the hospitalization rate for COVID-19, even though that might not be indicative of the most present infection. Down the road, I think once we partner with our state health department colleagues, we'd like to see sort of what they do with the flu in terms of monitoring disease, which is something that's called a syndrome surveillance, which is they have a real-time monitoring of emergency room data with respect to the number of people who present with flu-like symptoms, such as fever, cough, very similar to COVID-19. So we'd be collaborating very closely with our state health department colleagues around that to see if that data source would be available for us. If Director Bond has anything to add on that.
No, you covered it.
Thank you. And then my last question is for you, Mayor, about what you've heard in the intervening day from the public in response to your latest executive order requiring face masks inside essential retail. And if you could explain in a sentence or two again why you feel like this order is necessary at this time.
Sure. So I've actually gotten a lot of very positive comments about the order. Some people saying it's about time because a lot of people have felt that they're doing their part by wearing masks, but other people are not, and they're putting themselves at risk in a store when people are trying to get essential needs, and other individuals in the community do not wear masks. And so I've gotten a lot of positive feedback and frankly, very little negative feedback. And I think that it's important to underscore and remind people that when we talk about masks, we're not talking about anything you need to buy. It can be a handkerchief or a towel that you tie around your face. It's just got to cover your nose and mouth. And the importance of wearing masks is to protect other people, so that when you sneeze or you're breathing, even though you may be asymptomatic, you might actually have COVID-19 and not know it. And by you wearing a mask, you're preventing your germs, or you're reducing the likelihood of your germs being spread to other people in the community. This is something that's responsible for us to do. And the order is pretty simple to adhere to, and we're asking you to do that.
Thank you very much. That's it for me.
Thanks. I saw Mary had another question.
Is the state on board with this? I mean, is the city further along, or really sort of setting the pace on the contact tracing?
So I would say that the state is thinking about this as well. And you can ask the state. In conversation I've had with the state, they're working hard to collaborate with some of the other states on a larger approach to COVID-19. And I think you saw that recently when many of the Eastern and West Coast states decided to form some sort of alliance, if you will, to work on these issues together. I know that the state is thinking hard about how to open up, and understands that testing and contact tracing are an important component of that.
Okay, maybe just one more question on that. How many volunteers would you like to see?
A million.
A million, okay.
I'm joking.
One third of the state, okay.
I don't know what maybe Director Bond or Dr. Jalal, you have some sort of estimate of what's appropriate, or you don't have to give one, of course, but.
Yeah, we want to recruit. We want to be able to not have a backlog. Right now, we are steady and on target. So we want to continue recruitment just to be able to have people trained and ready to go as we need them.
Wow, so you've traced how many people now? There's all these people that have tested positive have been traced.
As I mentioned earlier, Mary, I will provide a full detailed report in the near future.
Right. But Mary, I think one thing to note that, of the 859 cases, many of those people, they were identified well over 14 days ago. And so contact tracing for those individuals doesn't have as much utility as someone who we find out about tomorrow, who is more likely to be spreading the disease to more people, and we can get on top of it much faster. And also, it's important to know that of the 859 individuals, I think I said 859, I just checked our number, and our updated number is 859. There is missing information, right? We don't have everyone's phone number. Some of the phone numbers might not be accurate. So I don't want you to report that the health department is fully doing contact tracing on all 859 people, because for a variety of reasons, we're not able to do that, or it doesn't make sense to do that. Moving forward, our ideal is that we do contact tracing with everyone.
All right. I mean, the logic is if it's past 14 days that people have gone through the the isolation and
It's called the incubation period, and so the CDC guideline says 14 days, or without any symptoms within the 72 hours, without having any non-pharmaceutical drugs. And so we followed the CDC guidelines when we developed our framework.
Okay. I mean, all right, you can't give a number at this point, but I think you said you were on top of it now. You want to keep ahead of it.
Yeah, we're ahead of it at this juncture. And in addition to what the mayor said, again, we want to emphasize that we provide daily reports, and we do have a large percentage of individuals that we're working with those facilities that offer testing and are filling out. We want to make sure that they get the message as well, that it's important that they fill out completed forms, because it will assist us with doing contact tracing. Okay.
And I just have one question. At the very beginning, you gave an update, I guess, on the nursing homes, the ones that you've been talking about before. Grimes, I thought we were talking about 69 yesterday.
So Mary, what we can do is offline, I will email you the numbers. I emailed you a report last night, and I can do another report to you after this press conference.
Okay, so I just didn't want to misunderstand, because the number was so different for Grimes today.
So I provided you a report yesterday, and I can email you another report today.
Okay. Thank you.
All right. Thanks, everyone, and we will see you soon. Take care.